Welcome back to this week's episode of Speak Your Mind on Gold FM, only the classic hits. Many thanks for your company. Now, International Women's Day was marked recently on the 8th of March. Our guests include from the United Nations Population Fund, the Director in the Pacific, Mr. Bruce Campbell, as well as the Fiji Women's Crisis Center Coordinator, Shamima Ali. A warm welcome to the both of you.
Welcome. Thank you very much.
Now, what is International Women's Day about?
Well, what it says, it is about women. It's about women's rights. It started in the 1800s with women workers, factory workers and so on around Europe and America, calling for better working conditions and so on, and protesting and marching and so on. So it started from there, and now, of course, it has been mainstreamed, and some people call it UN International Women's Day, and activists like me say, no, it came from the women's movement, and so it's now marked on the 8th of March, and as the day when women it's a Women's Day. I mean, every day is a Women's Day, but it's a day when we take stock, we look at our achievements, celebrate our achievements, how far we have come, but it's also taking stock because the struggle is still ahead and there's still a lot of challenges left, and how do we tackle with those? But definitely it is a day of celebrating women, their achievements, women's rights, and so on.
Lovely. Thank you very much, Shamima. Now, Mr. Campbell, you might like to touch on the theme of International Women's Day and what it means.
Well, thanks so very much. And thank you, Louise, for having us. And Shamima, it's great to be alongside of you on this very important commemoration. And I think as we've celebrated International Women's Day just last Friday under the theme, Think Equal, Build Smart, and Innovate for Change, let's celebrate the women innovators around the world who are breaking down the barriers to rights and choices and building a more gender equal world. Women's empowerment and gender equality are critical, not only to achieving the sustainable development goals we hear so much about, but also to finally realizing the vision of our own 1994 Conference on Population and Development that highlighted the importance of equality and women's rights. Now, 25 years ago, this path-breaking event since this path-breaking event, hundreds of millions of women still lack the power to make fundamental choices in their life. And it doesn't have to be this way. I think that's what's really critical for us. That's why UNFPA, together with all of our partners, is innovating as one of the themes of the day with our partners for contraceptive choice, for safe birth, and to end violence and harmful practices against women and girls. So we use the theme of this day for that very important work that we're supporting across the Pacific and here in Fiji as well with all of our many partners who have a common interest.
Okay, thank you very much, Mr. Campbell. I know I went on Twitter and I did see your tweets, and very good. So, bringing in birth control. Why were you thinking of, increasing awareness for women to take birth control, contraceptives?
Yeah, well, we don't use the word birth control. We talk about choice. It's
not
about
it's
control.
A choice. Okay,
and there's a fundamental difference there. I would like to help to clarify that. It's not about control at all. And the freedom of choice, that fundamental freedom for women in the world today has really been, I think as Shamima has said, one of the liberating factors of the early women's movement. And we can think back historically to Margaret Sanger and others as well. The global hashtag is also balance for the better. And balance for the better is also related to choice. It's really hard to have balance without choice. In a balanced world is a better world, and that means gender equality and equal opportunity for both women and girls.
Yes.
It means gender balance in the workplace. It means gender balance in leadership positions. It's always great to stand on the shoulders of the many great women leaders in Fiji. During the launch on Friday, we had a really nice gallery at the Novotel, which showed 30, I think there were at least 30 pictures and little biographies of great women in Fiji. And I think we're standing on their shoulders. And we certainly want to see further representation of women in private sector, in public space. So we look forward to that kind of equality and supporting the overall efforts to have a balanced society.
Thank you. Now, relating to the theme of IWD this year, A Balanced World is a Better World, how are we in reality faring on this theme in Fiji and the region? Shamima?
Yeah, we can we can talk about balance and gender equality till the cows come home, and women's participation and so on. But I think one of the things that underpins even things like where birth control came from, for me, it's about men controlling women's contraception choices and being able how many babies they're going to have. So underpinning all of this is the issue of violence against women and girls, and domestic violence, rape, sexual abuse of children, and so on. These are the things that often are impediments, so we have to address those issues. And, for so many women, there's so much coercive control because of the genderized nature of society. And there's so much control about how many children they can have. We have in Fiji the boy preference. We still have that. I've been doing workshops for the last 6 weeks, workshop after workshop, and with people from Fiji and so on. And every time I talk about a boy, is there still boy preference? Everyone laughs, and of course no one says, no, there isn't. There still is. So women, forced to get pregnant till a boy arrives.
Yes.
That is still a reality for many, many women, as you can see, as a local woman, you can see.
Oh,
So
very much so.
I think those things also need to be addressed. One of the things about International Women's Day, for me, has been it's too corporatized. It's always talking about it. And if you see all the media that women got of women in the corporate world, women who are in privileged places, it's about class also. We hardly touched on women in the rural areas and what are they doing. No one talked about them. People were just talking about themselves. And I don't believe International Women's, it should be an all-encompassing. It should be realizing that the further away from Suva, Lotoka, Ba, Nandi people are, the worse the situation for women. So I think when we talk about balancing, we need to bring every woman in. Every woman counts, and I think those are some of the challenges that we have. Even women's political participation, women's right to make choices, these are all impeded when women make prisoners of themselves within their own homes. The fear of violence, the fear of going out and getting raped on the way somewhere. Rape is everywhere. Women get raped by all kinds of people, particularly people that they know and trust. So, so these are also issues. For me, there is no theme. In Fiji, we started marking International Women's Day in 1986. And 87 and so on. And so we started marking it, and we create our own themes. We look at the theme globally, but as part of that, we look at what is topical for us in this country at this point in time, and we work with that. And so various, women from different sectors are doing different things, but I still believe that the rural women are still disempowered, and we still do not take them into account when we talk about women's achievements.
Oh, thank you very much, Shamima. I mean, that's the reality that we face. And Mr. Campbell, I'm sure you do great work in helping our women in Fiji, and you might like to share with us what it is that you do.
Okay, well, thanks very much. And I think underlying the women's movement and the dignity and respect and the equality that we all envisage in the Sustainable Development Goals, the language, we have to move beyond the rhetoric. So I fully agree. What are we doing on the ground that really makes a difference? And we've been very fortunate, and we have to be thankful for generous contributions from Australia, from New Zealand, for others, for the work of the UN. And through those contributions, we first and foremost developed strong partnerships on the ground with civil society partners like the Fiji Women's Crisis Center and many others, with bilateral partners, with multilateral partners, and with aligned ministries. Our work focuses on universal, and what we mean by universal means really universal, including people with disabilities, the marginalized, the far-flung communities on the small islands around the Pacific, universal access to sexual reproductive health and rights. Now, in order to have universal access, we need a really strong health sector, and our principal work in the area of universal access to safe motherhood services for women who are pregnant, for contraceptive choice. I refer to choice, not
you
control.
Don't mind, Mr. Campbell. We'll just finish off from where you're talking now, because we need to head into a break on Speak Your Mind, Gold FM, only the classic hits. Do stay with us for more. Welcome back to Speak Your Mind on Gold FM, only the classic hits. And we do have our guest today who've been kind enough to come and talk to us from the United Nations Population Fund Director. This is Mr. Bruce Campbell, and the Fiji Women's Crisis Center Coordinator, Shamima Ali. Now, Mr. Campbell, you left off of the great work that you do, and I would like you to finish off what you were saying, as you finished off with women having a choice of contraceptives.
Yeah, women having a choice of contraception, women having access to safe birth facilities. And I think the key here, the relationship referred to earlier about women who face violence, domestic violence, intimate partner violence, we see the potential of the health workforce. When we talk about universal access to sexual reproductive health services, we also talk about using the health workforce to provide referral pathways for victims of violence. Because sadly, all too often, the first port of call for a victim of violence is the health sector. And that means there's been a physical or sexual injury. And so our support for the universal access to sexual reproductive health and rights includes access to services and referral pathways for victims of violence as well.
Okay.
I'd just like to jump in there a little bit and talk about some of the achievements on referral pathways. That Fiji is is the first country, I work around the Pacific, which has a service delivery protocol that has been published, and that was a real good collaboration between partners. The Elimination of Violence Against Women Task Force, which is chaired by the Ministry for Women, and the UN Women through the Pacific Partnership, funded by DFET and European Union, and the NGOs and other government ministries and so on, and UNFPA and other UN agencies who have come on board. So that is, a unique document that has come out, and that actually addresses it has got referral pathways of where, when a woman is going through violence, where are the places we can refer her to. And that is a unique document, and it's going to be rolled out in the next few months. So I just wanted to talk a little bit about that. I also wanted to say something about partnerships, that partnerships are so vital in this work, the collaboration that we go through. But I think also we need to be a bit careful when we say, what does true partnership mean? That one of the things, when I can talk about violence against women, and I believe that in the Pacific, there has been tremendous work done over this is our 35 years of existence. And the Pacific Women's Network Against Violence Against Women, which we chair, was established in 1992. So there's very innovative work. We have thought globally, but we have acted locally. So I think when we're talking about ending violence against women, promoting gender equality and so on, that there has to be mutual respect between the partners. The donor agencies, the INGOs, UN agencies, and so on. And it's a work in progress, and that there's no, that we know, and our right to self-determination. I think that is really important, that there is that conversation going on. We have begun the conversation, and there will be more of it, because otherwise, we've got the Pacific, the Spotlight program. There's a whole lot of money that is coming into the Pacific on ending violence against women, promoting gender equality, and so on. But it will all go to waste if we don't build on each other's expertise and knowledge, and we don't follow universal good practice and rights-based approaches, human rights of women and so on. So I think those things also we need to make this thing work, to really achieve balance for women to be able to make choices about their lives and so on. We have a tremendous responsibility, the stakeholders, the people who are in this arena, to ensure that happens, and the partnerships are collaborative and mutually respectful.
So do you think that women have made a significant improvement since the Fiji Women's Crisis Center began its work 35 years ago?
Well, in my lifetime, I've been there for 34 years, half my life, I think.
Do you think they're more aware of their rights,
I
would
tell
say?
you, there are. When people think that there is a huge increase in rape because it's being reported, we don't get, we panic every time we see a rape case, but we don't get excited and say, oh my goodness, it's increasing. We say there is increased reporting. Definitely, I have seen the achievements, the advances we have made in terms of legislation, in terms of women knowing their rights, women accessing justice. Still a lot of work to be done. Law enforcement agencies, improving their act a little bit, the health services and so on, but still a lot of work to be done. We've got good legislation. The whole problem is we can have everything good. We have a service delivery protocol. We have good police training and so on. We have to shift the mindset, the cultural attitudes, the religion and culture comes in between. And that is what the job of the crisis center is, to shift that. We've seen a lot of faith-based organizations come on board. We have seen traditional leaders come on board. Just the week before last, we had the Ethiopia Affairs Board in partnership with the Ministry for Women and the Crisis Center. We came together for a week, and there were some very frank, open, sometimes very difficult discussions, but we managed to get through that. So the traditional communities are coming on board. The government has come on board.
Oh, that's nice.
We've got the toll-free child helpline, the domestic violence toll-free helpline, which they are funding and contracting NGOs like us to run, and things like that. So a lot of improvement, but still, I would say, still a lot of work to be done.
All right. So I hope we've got men also aware of the fact not to be hitting their wives.
Yeah.
What's the statistics like with that? I mean, in all these years, has there been much change? I mean, they get furious and...
No, actually, domestic violence comes from... Fiji has got a very, very high rates of domestic violence. The national survey, Somebody's Life, Everybody's Business shows 64% of women have experienced domestic violence, which is pretty high on the global platform.
Right.
We are going to do the comparative study. We're getting ready for it for 10 years later. So we will be able to see whether there has been any changes or not. Unless we do that, we can't say it has increased, unless we have some, closed group work done and research done in closed communities and things like that. But that will be, I'm really hoping after 10 years of work, we will see some changes.
I think it's important, if I could just add to that too.
Sure.
We have to look at this very critically, very analytically, and have good data. There's a lot of anecdotes and there's a lot of sensationalism around violence. Okay. And unfortunately, sometimes, and I look to you in the media to be champions of honest brokering of information, because too often we take extreme cases and paint a picture that may not be realistic. So the data is fundamental. And the Fiji Women's Crisis Center did an excellent job of the national survey, and it's time to repeat that. But there's also going to be line ministry data sets as well. And I wanted to agree with you. And when we see those rates going up, there's a possibility that's not necessarily bad. That's an increased comfort and an increased effectiveness of the system, that women are now willing to come forward. And again, I would hope that reflects itself in something positive overall as we see ourselves moving forward. There will be more cases, and that's not necessarily a negative.
Right. On Speak Your Mind, Gold FM, only the classic hits. We'll be back in a moment. Speak Your Mind on Gold FM, only the classic hits. Thanks a lot for your company. And we talk to the United Nations Population Fund, the director in the Pacific, Bruce Campbell, and the Fiji Women's Crisis Center coordinator, Shamima Ali. Thank you so much for coming along. Now, just one question. How can we get men and boys involved in improving the lives of women and girls?
Well, if I could just quickly respond to that. There's no, violence always involves men and boys, yet we have often left them out of the equation when it comes to prevention, to mitigation, to follow-up care for perpetrators as well as victims of violence. So the concept of men and boys, particularly in Fiji, we need to engage them from a very young age. And we look at engaging boys at age 10 already in family life education curriculum, work for in-school boys. We're also looking, working with partners for out-of-school groups as well, and working with youth partnerships as well. So boys have to understand at the youngest possible age the importance of equality. And that's not something that you can instruct just you need to have a structured curriculum that brings that out in a very professional manner.
Okay, so...
Yes, I believe that if we keep saying men are the perpetrators, and if you look at patriarchal structures, and if we want to change it, then we really have to have men. And I don't say as partners. You have partners when you are on an equal footing, So we look at we do a male advocacy program in Fiji. We started in 2002, and actually we began with the military, and that was the hardest one, So our present Prime Minister used to be the commander, used to give us about 25 men for 2 weeks to work with them. and recognizing high levels within security forces of violence within families and so on, which is a good thing. And so we started with that. That was our baptism with fire, and we started doing our program, and it's about getting men in the first week. It's called Male Advocacy for Women's Human Rights, and it's about getting men on board and taking them through a week of awareness, gender sensitizing, looking at domestic violence and so on. And then a lot of men stayed back, and then we started, and then we did it with all men who are in places of influence, like police officers, traditional leaders, priests and so on, youth leaders, and policy makers and so on from government. So getting them together, and the whole idea is, but their accountability has to be the women's movement. Men can't go off, and I believe that as a feminist, that you can't go off and do your own thing, because we've seen globally programs which have gone really bad because women were not involved. Because programs about ending violence against women, promoting gender equality, must be based on women's experiences of violence, of inequality, of discrimination, and so on. So it's about getting men together, recognizing their the violence, the inequality, and so on, then wanting to do something about it in their spheres of influence, changing their own behavior and changing the behavior wherever they are, within their families, within their church groups, within their traditional settings, and within their workplace, and so on. So that's the idea. It's working very well. It's aligned to best practice, and a lot of men around the Pacific are wanting to be part of that program. So that's one way to go. But definitely we need to start with the boys. And there are programs in Fiji with NRL, AFL, but we need to develop our own local programs also, and including it in the curriculum. It starts in the school and, in parenting classes and so on, when you go out in the community, when the faith-based organizations play a very important role. So we all need to get involved, and we really need to start at that age. I would say
Absolutely.
kindergarten,
Yes.
school.
So
Yes,
that's
yeah.
what you've said, Mr. Campbell. So you're looking at getting this all done in schools.
Right.
That's work still going, or?
It's going, and we're looking at increased investments in this area, again, with a number of different partners, with Ministry of Education, but Ministry of Women's also involved, and looking at an exchange between the health sector as well for adolescent sexual and reproductive health, also engaging in the schools. But we're also looking at innovative ways through out-of-school programs. Right now, many, many young people learn about the role that they play in society on social media.
Yes.
So we're looking at ways to use technology as well to get positive messages out about equality. If I could just come back, I think one of the critical pieces, whatever we're going to do, we need to have strong partnerships. And Shamima, you mentioned that before.
Yes.
There's no one agency, there's no one civil society partner, there's no one line ministry that can do this. And just to highlight that, I think in Fiji, we do demonstrate a very strong collaborative spirit. And going forward, whatever it is that we do, we need to continue that spirit that brings all the major actors together, but not just at national level. I think, and we're referring to it here, behavior doesn't change in cabinet or on the streets of Suva alone. We need the faith-based organizations, the civil society partners at community level, and we need the headmaster of a school, as well as a health sector partner at a health facility in every village to take up the messaging around equality, around fundamental choice and rights, and to find a way with the assets that they have, particularly at community level, to bring home this important message that International Women's Day stands for.
Okay, just on the theme that, for the better the balance, better the world. We'll touch on that again. How can we achieve a more gender-balanced world, do you think?
Okay, whatever we've just said.
Okay, well, what I want to say is, how come, if you have someone with the exactly same job, okay, male and female, they do the exact same work, but they're paid differently. Why is that? Can someone answer me that question? Is it really happening a lot?
Well, I
Does
think,
it continue
I think
to
there has
happen?
been a lot of improvement, but there that's still a work in progress. In Fiji, I can say so, because women do complain about that. When we are talking to them and doing some consciousness raising, there is that. It is because of, women's work is often trivialized from the home. So it's like the mindset, and it's so ingrained. There are 3 stages in our lives. One is the genderization, where we're told how to be a male and a female, and often to the detriment of the female. Then we have the internalization. We start believing it, normalizing it, and then we institutionalize it. So those are the 3 stages. And it's so ingrained generation after generation.
I mean, in
that
the
it
world.
works out everywhere. It plays out everywhere. You're in an office and, as soon as it's tea time or there's a function and you need to make cakes, everyone looks at the women, even though that woman might be an executive, and things like that. So it carries on that whole thing. And that is why that mind change is so important.
So it can't be easy. It's been happening for so long. It really is unfair, I must say. But I can say something good about FBC. We've got a lot of women in good positions, and the men served us morning tea on Friday, International Women's Day.
That one day.
Yes, that's
that
one day. Right.
One day. We
Yeah.
need that 365 days of the year. Can I just give one example? If we look at a 10-year-old girl today and where she'll be when she's 25, and that's the duration of the Sustainable Development Goals. If in Fiji, that 10-year-old girl drops out of school, she becomes pregnant and drops out of school and stays at home and doesn't ever enter the marketplace in terms of equal pay, versus another girl who stays in school, goes on, gets a college education, gets decent work, and just imagine she can get double the minimum wage, which is not too much to expect, is it, in any world? You've finished double the... When she turns 25, if she doesn't have children versus the one that starts childbearing as a teenager, she'll have 40,000 Fijian dollars in her pocket. It's a really powerful message to say that we can change with simply universal access to services, and the right to make choices for one's own life. If to enter a relationship, when to enter a relationship, if to have children, and when to have children can be truly transformative and raise gender parity, but also economic parity and overall sustainable development.
And I think we can only do that if we break down the patriarchal structures of society.
Yeah.
We need, if you want to bring about equality, and when we can allow girls to have access to all those services, education, and so on, we have to address patriarchy.
Yeah.
Well, thank you very much. Unfortunately, our talkback has come to an end. Many thanks to our guest from the United Nations Population Fund, Mr. Bruce Campbell, and, of course, Shamima Ali from the Fiji Women's Crisis Center.
We look forward to coming back.
Vinaka, thank you. We'll be back for more on Gold FM. Speak Your Mind. We've got the World Mosquito Program guest coming in next. Speak Your Mind on Gold FM, only the classic hits, and we welcome you back, and we've got something different. Now, mosquito-borne diseases are always a health concern, and it may come as a surprise to you to learn that mosquitoes happen to be the world's deadliest animals, but, insects, right? Why? Well, it's because of the harmful diseases that they're known to spread. So the World Mosquito Program and the Ministry of Health are working together to keep mosquito-borne diseases under control, such as dengue, Zika, and chikungunya. Now, the Wolbachia method has been rolled out already. This is in the Suvarnasori corridor, and it's going to be done in the West soon. Now, joining us on the program is the WMP's project coordinator, Mr. Amniasitavui, and Senior Communications Officer, Mr. Wame Valentine. Welcome.
Thank you very much, Louise. Pleasure to be here.
Oh, I like you two's shirts. Very nice indeed.
That makes 3 of us there.
Anyway, we'll just start off with, what is Wolbachia?
Thanks, Louise. Firstly, I think on behalf of the coordinator, we thank you for giving us this opportunity to be on your program and also to speak to your listeners listening in on Gold and indeed speak your mind. So Wolbachia is a bacterium, and this bacterium exists in insects around us. 60% of insects, in fact, that live around us. And these insects include fruit flies, moths, butterflies, etc. And so what we do at World Mosquito Program is that we bring this bacterium and we insert it inside mosquitoes that carry the dengue virus, chikungunya virus, as well as Zika virus. The cool thing about this bacterium, Wolbachia, is that it prevents the transmission of the virus from the mosquito to a healthy person. So that's a wonderful thing about our method. It's 100% natural, being a bacterium. It's 100% safe, and also it's a sustainable method. So we're quite excited about that. We're excited to bring that through to Fiji, as we've been doing last year in the Suva-Lami along the way to Nakasi corridor, the Central Division, and we're excited about bringing that to the west this year in Nandi and Lautoka.
Okay, so we might have Mr. Tavui tell us a little bit about how it went in the Suva, Lami, and Nakasi corridor. How did it go? How did people react to this thing? Because it's new.
No, Olive, it's you're true. It's an innovation initiative. It's a unique project on its own. And we are so grateful of the supporters from the communities at large, starting from Lami, Suva to Nasino and Nakasi corridor. So we've started releasing mosquitoes with Wolbachia in July last year, on the 16th of July, up until now. And as we speak, we have seen progress in the sites that we've released these mosquitoes in, and so far, in all the 12 operational sites we have stopped releasing in 5 sites. So these sites are namely Lami, Cunningham, Tadirua, and it's Tamavua and Wailoku, Kalambu, Naveawakau, and also Kinoa. So out of the 5, we are currently, out of the 12, we have stopped releasing in 5 sites. And now we are continuing in other 7 sites. So by end of this month, we should be completing the Central Division project and heading on down to the west, to the Burning West in April next month.
Oh, okay. So why have you stopped releasing these mosquitoes in the 5 sites?
So what we believe that we've reached the Wolbachia level in the mosquito population in these 5 sites that Mr. Tavui had mentioned is high enough. In these particular sites, and we believe that they're high enough to sustain itself and to increase naturally. The idea and how Wolbachia works is that once Wolbachia is established in the mosquito population, the chances of a dengue outbreak would be very small. The chances of a chikungunya or even Zika outbreak would be almost non-existent. So that's what we're working towards. We're working towards releasing Wolbachia-carrying mosquitoes and also continue to release them over a certain period of time. And for the most part, that's 10 weeks, but give or take. And we will continue to monitor these sites to ensure that Wolbachia levels in this mosquito population is high enough.
Okay, so how do you monitor? I mean, obviously, scientifically, you must do that. So
Yeah, we have this device known as the BG traps, Biogen Sentinel traps, that we give to 300 hosts, people in our communities from Lami right to Nakasi, and we were grateful that they were so willing to support us in this project, and they've given us the okay. Please give me one device, and it's electrically powered. So it's we need power to operate this device. And what this device does is it attracts all insects that flies above it. Because there's a fan, a small fan in this device that pulls or attracts all insects that flies across.
I see.
Yeah. So what our field team does is they go daily and collect all these specimens in all these devices, and then we send we bring them back to the lab, and we try and separate all insects. Because we have other species. We have 26 species of mosquitoes in Fiji. So we only are concentrating on one, and that is the black and white striped one.
Which spreads the
which
dengue
is known, Zika and chikungunya.
Oh, okay.
And that is the Aedes aegypti mosquito.
Right.
So as soon as we have the Aedes aegypti mosquitoes separated, these specimens are then sent back to Monash University in Melbourne on Tuesdays of every week. And they do the Wolbachia screening for us. And that's when they tell us, you should stop releasing in these sites because the Wolbachia level is high enough to sustain on its own.
Oh, that's good. I mean, I'd love to see dengue fever disappear, but I know it won't disappear. But I mean, we've had so many cases, so it's great. So, Wami, which countries have carried out release trials of Wolbachia?
We're excited that we currently operate in 12 countries around the world. We obviously here exist in the region, in the Pacific. World Mosquito Program is in Vanuatu, as well as New Caledonia and Kiribati. Obviously, we also exist in Australia. Releases have been happening in northern Queensland, towns like Cairns and Townsville, and we also exist in Southeast Asia, as well as Central and South America. I miss the guy who's telling us that the time's up.
Yeah. Oh, but actually, we can come back to it.
Yeah.
All right, on Speak Your Mind, Gold FM, only the classic hits. We'll be back soon. Speak Your Mind on Gold FM, only the classic hits, and I do hope you're enjoying the program. Our guests today are from the World Mosquito Program. We have the campaign and engagement manager, Wame Valentine, as well as project coordinator, Mr. Amini Sitavui, talking to us. Now, sorry to cut you off there, Wame, but yes, it's a good feeling to be one of the 12 countries who have actually released Wolbachia. So you can continue from there.
Absolutely. It is a wonderful feeling, especially considering what we are hoping to achieve. And we're excited about that. We're excited to be a part of this project. And of course, we're grateful to our partners. We in partnership with the Fijian government through the Ministry of Health and Medical Services. And they've been wonderful from last year and wonderful as well this year as we are working towards moving to the West. We are also grateful indeed for the support of our funders for our Central Division project last year. From Suva, Lami, all the way to Nakasi, we were funded by the Australian government's Innovation Exchange.
Okay.
So that was wonderful. This year, though, moving to the West, we've thankful for the generous support of the New Zealand Aid Program. So we do work with a great number of stakeholders, funders and partners as well, one of which also is the Live and Learn environmental education. And of course, one of our most important stakeholders is the public. I think one incredible aspect or component of our work is the fact that we do not engage our activities in a site unless we get public acceptance. And that's a wonderful thing about the World Mosquito Program. Yes, we've got the approval from Cabinet, from government to commence our work. In fact, that's been the case in the other project sites around the world. But we work in a way that once we get public acceptance to release Wolbachia carrying mosquitoes in our project sites, then we'll commence our work.
Okay, so tell me, how has public reception been like?
It's been incredible, Louise. As you could imagine, coming up with such a new initiative, you'd imagine folks would be somewhat circumspect about it.
Yeah, I'd say I was like, what? Releasing more mosquitoes into the atmosphere, just as if we don't have enough mosquitoes.
That's absolutely no. That's quite right. A number of folks had an eyebrow or two raised, but and that's why we're here. The engagement and campaign team. Our work is to inform the public about who we are, what we're trying to do, what we've achieved, and what we've done in other project sites around the world, and what the results show. And we meet up with them regularly in different communities, whether it's residential or even if it's a village setting, if it's within our boundary, we meet them, we sit with them, we talk with them, we talanoa, we answer some of their questions. And at the end of it, a public acceptance or pre-release survey was conducted. This was a survey to determine whether the community is on board with our method. And we were quite thrilled because it was an overwhelming amount of support. 98% of individuals who responded to our questionnaire said, yes, we're excited about the work and we're happy that you'll release it here.
So that shows they have an understanding of what you're trying to do. Because, obviously, if people understand, they will accept it.
Absolutely. Which is why we're grateful for opportunities such as this, Louise, because this is an opportunity for us to reach an even wider demographic and let them know about what we do and who we are, and invite them really, if they have any questions or if they're unsure about how we work, to please look us up on Facebook, facebook.com/WMP Fiji, or they could always drop Mr. Tavui and the team an email at fiji@worldmosquito.org. and let us know, and we'll respond, and we'll meet their needs.
Oh, okay, so you're heading to the west, right? So when do you plan to actually get these mosquitoes released, and how do you release them, by the way?
Thanks, Louise. First of all, people will be asking, are they the Sovo mosquitoes you are releasing in the west? Well, just to confirm, assure them that these are the only mosquitoes from Nandi and Lautoka. We are using the same mosquitoes because we've already sent their eggs, mosquito eggs, to Monash University, where they had this backcrossing with a mosquito that has the good bacteria known as Wolbachia. Now they've started sending us back the 6th generation of eggs from Monash University, and we are rearing them now at the lab up in Mataika House in Tamavua. So hopefully by mid next month, these mosquitoes are ready to fly, and this is when we are planning to have our releases done in the west, in Nandi, and also in Lautoka. So just to reassure the public, it's not mosquitoes from other places. It's the same mosquitoes that we collected from Lautoka and Nandi, and we sent them. Now we are rearing them back again. But the difference is it's got the good bacteria.
Right, it's been done overseas. They've put into our local mosquitoes.
Absolutely.
So once that process is done, like the releasing of Wolbachia mosquitoes, they will then mate with wild ones out in communities. And this is when it will pass on to the offsprings, the bacteria. The good bacteria will then pass on to the offsprings. Yeah.
So what happens when the good bacteria is passed on to the offsprings? It
blocks the transmission of diseases happening, all of the three diseases.
Dengue,
Zika, and
chikungunya.
chikungunya.
Oh, that's really good.
And that way we'll achieve a high number of Wolbachia in the mosquito population. If you recall what our coordinator had mentioned earlier, once there's the Wolbachia levels in the population is high, we'll cease releasing there. Because that means we've achieved what we wanted to achieve. Even a higher Wolbachia level would also mean a very low chance of a dengue transmission or chikungunya transmission or Zika transmission in that community. So, I mean, adding to what Yasi had mentioned, we've already started conversations with stakeholders in the West. We've been grateful for their support also, the Commissioner Weston and his team, the town councils in Nandi, the city council in Lautoka. We've also spoken to a number of other stakeholders in the West, letting them know of who we are, what we're doing, and what we're bringing to the Western Division. And so far, it's been overwhelming, the positive response we've got from them.
So you're going to have a bit of a fanfare when you get to release the mosquitoes? I mean, I remember last time, sorry I didn't come, Wame. You invited me for, I know you invited children. And so you're going to have the same thing in the West?
Funny you should mention that. We're literally in the planning stages of it.
Okay.
So actually, this would be a good opportunity to plug it on your show.
Why not?
We've got the Mbula Wolbachia Day coming up in Lautoka on the 23rd of March, which is next Saturday, I suspect. And we are inviting residents in Nandi, we're inviting residents in Lautoka to come all down to the carnival ground. I understand it's in the heart of the sugar city. We should have bouncy castles there, which will be free of charge. We also will be giving away hot dogs. There'll also be some very healthy food stalls there as well for you to take advantage of. They won't be free. You'll have to pay for those.
And the best thing is that you're teaching people about what you're doing.
Absolutely.
I mean, you might have some future scientists there. Who knows?
Absolutely. Absolutely. That's correct.
Yeah. Okay. I'm sorry, Wame. It's actually the end of Speak Your Mind right now. But,
Thank you very much.
It's been lovely talking to you both from the World Mosquito Program, the project coordinator, Mr. Amanyasi Tavui Vinaka, and also our campaign and engagement manager, Mr. Wame Valentine. Thank you. On Speak Your Mind, until next week, I do hope you enjoyed the program. Nisa Modemanda.